I think there'll be more of a standardization of medicine to follow best practice. I would like to see, in addition to the computer-based charting and ordering and all that, I would like to see telemedicine brought into it, because telemedicine would give us some of the specialties we don't have at our hospital that would allow us to keep more of our patients there and treat them as effectively. And it's been shown, especially for critical care, that you can do as good or a better job, not better than what they do at their facility, but you can do a better job than what you can do without it. So you can provide those services to your patients. Tertiary centers, that's where their market's going to be, because they don't want all those moderately sick patients coming to them because some facility's uncomfortable with them. They'd rather treat or help and assist their treatment at the hospital they're at, where they already are. For us to transport a patient somewhere, sometimes it could take 6 to 8 hours to arrange a transfer, get the patient to that facility. And that's not fair to the patients. That's a delay in their care. If I can talk to that person, again, their EMR, the specialist, the intensivist can look at their EMR, what we've done, can look at their present condition and vital signs, advise us on how to treat the patient. We're not delaying their care by 6 to 8 hours.
When you look at 2017, what do you see and what do you hope to see?
Connected healthcare, meaningful healthcare, and healthcare that centers around the patient, not around the IT, not around the doctor, not around the facility, but certainly something the patient has and the patient owns and has access to. And I think that's just as simple as it could be right there to connect the patients as well as the doctors. So, to a certain extent, we've also, to a whole huge extent, we've got to engage the patients. We've got to get them to understand too that they also have a stake in our health care.
That's a challenge.
Yes, it is. Yes, it is. We've got to embark on education programs. You just can't treat the patient. You got to make sure the patient understands what you're trying to treat them for and what the expected outcome is. So you really got to get the patient on the side of their health care.
Looking 5 years down the road to 2017, how do you think the healthcare industry in the U.S. will look different than it is today?
Well, I think it'll look different in that it'll be leaner. I think it'll look different because it'll be better. If you talk to people about healthcare in the United States, they say we have the best technology, we have the best healthcare providers, and we have a dysfunctional system. I think what we're going to see is the systems get reorganized, restructured, so that the best technology, the best providers are put in the best structure, so that we can control costs, we can improve quality, we can sustain that. We can have coordinated care in a medical home setting as we are. We can decrease the cost of that care, sustain the quality of that care. And I believe the best days of healthcare in America are ahead of us, both for patients and providers and for the public interest. There's going to be some pain in the process, but I think that creativity, innovation is going to allow us to surmount that and move forward. And I'm looking forward to seeing what it's going to look like, not just in 5 years, but in 20 years. I think it's going to be very exciting.